Welcome back. This morning, we are exploring some of the ways AI can actually be useful for health advice, not for plastic surgery. Here to share when you should use it and when you should avoid it is Associate Professor of Medicine at NYU Langone Health, Dr. Roshini Raj. Welcome back.
Thank you.
Dr. Raj, thank you for being here.
My pleasure.
Okay, so people are using AI all over the place.
Sure.
Has it changed the way doctors look at medicine?
I think it actually has. Like, if I was sitting on this couch 5 years ago, I would have said, stay away, do not involve AI in your health. The point is now it's ubiquitous. Everyone's using it, including myself at times. So we have to find out when is it appropriate and safe and when isn't it appropriate. But yes, I do think there's some use.
When is it reasonable to use it for advice?
So a few different scenarios. One, I would say, is to kind of decipher complex medical terminology. So an interesting thing happened a few years ago where all of a sudden patients had full access to all their records, all their test results. If I do a biopsy on a patient during a colonoscopy, for example, they're going to get that result at the same time or maybe even sooner than I will. And it has all the medical jargon that it took me, 4 years of medical school to learn.
Which is so alarming.
It is.
Oh,
I get these panicked calls. What does mucosa mean? And I'm like, that's the normal lining of your stomach,
Right.
So I think that's kind of information put into AI. You'll get a brief description. Again, it's not going to replace your doctor's visit. You need to have that in-person conversation or online conversation with your doctor, but it'll give you at least a little reassurance or a little information to bring regarding the result.
What about dietary advice?
I actually think this is a great place where you can use AI. If I diagnose someone with fatty liver or celiac disease and they need to be on a specific type of diet, I don't always have time in a 15-minute visit to go over that diet.
So they can
AI
that.
I have this. What should I stay away
from? And you can say, I like Spanish food. I like, what are options within my cultural taste, my preferences, even recipes. I think AI is a great place to use for this.
Really?
Yeah.
Oh, that's interesting. I would never think about that.
What are other scenarios? I'm sorry. What other scenarios that you think would be appropriate?
I think a scenario that it could be really useful is preparing for a procedure or a surgery, for example. Again, your doctor will have specific instructions for you, but general things like, how long is the recovery, or when do I need to stop eating, or what are certain medicines I need to stop well in advance? Again, go over it with the nurse or doctor, but to give you some guidelines preparing for something, I think it can be very useful.
And when it comes to medications and supplements, can that help you with interactions or what to take, what not to take?
I would say it's sort of a mixed bag when it comes to medications and supplements. You never want to stop a medication you're taking based on something you read on AI. Talk to your doctor. However, it is a good place for check for interactions, to check for side effects potentially, although you might get a laundry list that scares the heck out of you. And also supplements. Your friend says, I tried a great supplement, you need to do it. Check with AI. Is there actual scientific evidence backing up these claims? Are there harms to the supplement? I think it could be useful there.
All right, we're going to take a break. When we come back, Dr. Raj will give us more tips on when we can use AI for health advice and when to avoid it. Stick around.
We're back with Dr. Raj, and she's been sharing some of the ways AI can actually be useful for health advice. Okay, so give us another scenario where AI is helpful.
So another scenario is, that yearly visit with your doctor. To prepare for that, kind of just put in your age, your gender, maybe family history. What are some screening tests you should be getting? What are some vaccines? For example, I'm over 50. I should be getting a shingles vaccine. Exactly. And of course, your doctor should be telling you all this, but doctors are human too. We forget sometimes.
Yeah.
Going in with that list can be very helpful.
What about mental health support?
I think AI can be really useful here. Mental health, unfortunately, gets often overlooked in the doctor's visit. It's super important to take care of your mental health. And now there are, ways you can find online support groups, for example, for issues you may be dealing with. There are even apps right now. There are games that can help with anxiety that I came across recently. So there's a lot you can find online to really support your mental health.
I thought initially you were suggesting that AI could be your therapist. And
I wouldn't go. And actually, we've seen some somewhat dangerous things happen there. I wouldn't go that far. Yeah.
What about when you're trying to find the right doctor?
I think it can be really useful. I mean, I've personally had the experience of my insurance company's website being very hard to navigate to find the right doctor. Sometimes just putting in your symptoms or your condition, your location, it'll tell you what kind of doctor you need, first of all, because patients can get confused about that, and who takes your insurance, who's available in your area. And specifically, if you have a rare condition or a loved one has a rare condition, you can really search for who are the top leaders in this specific disease and what kind of research have they done. Is it an option for me or my loved one?
Okay, so let's talk about, we already mentioned plastic surgery.
Yes.
What other medical scenarios should we avoid when using AI?
Well, first of all, you need to know yourself.
Okay.
If you're someone who gets anxious or overwhelmed with too much information, particularly in the health, if you're what we call a cyberchondriac, just stay away. Yeah, I mean, it's a real thing.
Love it.
And it can cause some very severe anxiety.
Sure.
People have done extreme things because they think they're
People
dying.
will avoid seeing, some
Yeah,
people will
that's true,
avoid seeing a
too.
doctor if they've already predetermined that they are dying.
Right, and there's nothing to be done.
Right.
So if you're that personality, you know it, just stay away. Wait for the doctor's visit and have that in-person interaction.
And don't use it instead of a doctor's visit. Don't skip appointments.
Correct,
See your doctor,
exactly.
yeah.
You never want, this is not a replacement by any means. It's just another source of information to bring with you to the doctor to have that conversation.
All right.
Dr. Raj,
For this and more, head to our website. We'll be right back.